And then we had to develop this weird category called asymptomatic spread because we were like, oh, and there's people who are testing positive without symptoms. They must be infectious, but without symptoms. That's strange, right?
Isn't that new?
Instead of,
Like, is that a new perspective?
oh yeah, no, it's a little bit backwards, right? So before they would say if they don't have clinical symptoms, then we would never test for anything. So then they would be negative. It's a negative diagnosis. So all of a sudden here we're like, oh, the test is positive, so that must be that they're clinically infective, which is really not true because it doesn't rule out the fact that you could have a false positive, right? So here, what we were doing is they use that to fuel fear that your neighbor then is spreading the disease to you. Whereas anybody who was looking at the data carefully would have basically said, oh, why don't we rule out the possibility that it's a false positive test? So again, that would be another one of those curious things like, they should know better than to make that assumption. And if they did want to make that assumption, then considering the impact that's having on everybody, what they should have done is they should have tested for infectivity and compared the two. So they would have said, let's do a viral culture, which is the test for infectivity, and see how it correlates with the PCR test. So considering that we've been a year and a half, and that I think the first study that actually did that, looking at asymptomatic spread came out in December, which was almost a full year after the pandemic started. And that, in that particular study, that was, Chinese, it was a retrospective review of 10 million Chinese people who had recovered from COVID. And, what they did was they tested them all and they looked at people who had asymptomatic spread, and then they followed them down, and they realized that, even though they were asymptomatic, they didn't test positive for the virus at all. And they traced all of their contacts. Nobody got an infection from them. So, that would have immediately disproved the theory of asymptomatic spread. And of course, a little bit later, we find out that the PCR test was never intended to measure infection, and has been not correctly utilized. So then, so all of a sudden we now, okay, asymptomatic spread isn't a thing. So do we need to be social distancing, and do we need to be locked down, and do we need to have all these measures? And so even though all this new data came in, nobody, including the people who should be looking at this, are adjusting our plan. So again, our team thought that was very curious. We're wondering why that is. Why aren't we asking increasingly more sophisticated questions, and why aren't we analyzing it in a way that ensures that our policies are appropriate? It's one thing to have some graces initially, but science should prevail ultimately. So I'm not 100% sure why that's happening, but those are some of the things that our team started to think was relatively curious. Like, why are lockdowns such a thing now? And asymptomatic spread, and then the notion of masks. Why would we all of a sudden think that a virus that's that size would not be spreading via aerosol spread, which is what would be normally expected? And why would we think that, a mask could stop that, knowing that the viruses are so small, and it's the actual fibers and circuitous nature of the fabric that is the stuff that stops the virus. And that any hole or gap would allow the virus to escape. Why would we think that a mask would help? That should have easily been disproven right out of the gate. And yet, to this day, we're still, recommending masks. So there's a number of curious elements to the interventions that we've, undertaken with little contextualization, a lack of sophistication in terms of analysis, and unfortunately, no course correction, which, we thought was a little bit concerning. And as we continued, it just seemed like, okay, so they're not, nuancing the data properly. Okay. And they're not, extrapolating, they're using, low levels of evidence, like for instance, case reports, which is the Chinese situation, to extrapolate to the whole world without any control. They're, recommending masks. They're creating a new thing called asymptomatic spread.
Please subscribe and hit the bell to stay up to date. If you liked or disliked the snippet, give it a like and share your 2 cents with us in the comment section. And remember, 6 cents makes change.